Welcome to The Debate. Today, we're tackling a really complex and sensitive issue drawn directly from our source material, the practice of labial elongation. Now, just for clarity, the material defines this as a cultural tradition, primarily seen in parts of sub-Saharan Africa, where girls and young women face pressure, often from family or the community, to stretch their labium minora. This is usually done to meet certain cultural ideas about womanhood or conformity or even desirability.
And we really have to grasp the seriousness of this right away. I mean, the significance is underscored by global health bodies like the WHO. They classify it as a serious violation of women and girls' rights, and importantly, as a form of gender-based violence. It's clearly rooted in deep structural gender inequality.
Absolutely. The material makes it very clear this practice is harmful. It cites non-consent, physical pain, psychological distress. There's no debate about the harm itself. But the core question for us today, I think, is less about if it's harmful and more about how effective the categorization is. So the critical question is really this. Does classifying labial elongation as a harmful traditional practice that's, quote, similar in concern to female genital mutilation, as many organizations do, does that accurately and, maybe more importantly, usefully capture the specific nature of the rights violations involved? Or is framing it primarily around those distinct violations, like bodily autonomy, coercion, interference with education? Is that a more precise, maybe more actionable path, especially given the clear difference in method?
Mm-hmm. And that distinction, I think, it matters immensely, not just in theory, semantically, but for actual real-world intervention.
Right. So my position is that this practice really must be categorized strongly as a form of gender-based violence and, yes, similar in severity and concern to FGM. I think this strong classification is essential because it correctly and powerfully identifies the root problem: structural gender inequality and systemic non-consent. We have to condemn the system that allows this harm.
Okay, and I come at it from a slightly different angle. While, look, there's absolutely no question this practice is harmful, it's coercive, it's a profound rights violation, I argue that maintaining conceptual clarity here is really paramount. We should be emphasizing the specific, distinct violations: autonomy, coercion, interference with a child's life and schooling. Relying too heavily on the FGM comparison, well, it risks blurring some critical legal and medical distinctions, especially since, as you noted, the material itself specifies the practices are fundamentally different in method.
Okay, let's unpack that a bit. Let's delve into why I think that strong classification is necessary. When we talk about gender-based violence, we're fundamentally talking about a violation rooted in structural gender inequality and societal control. And by structural inequality, I mean the systemic setup in a society that tells a girl her body must be changed, must be modified to serve some external purpose, whether that's for male pleasure or tradition or just fitting in. This whole framework, the one that treats girls' bodies essentially as objects to be shaped, that is precisely why the gender-based violence label fits so well here.
Right. I don't disagree on the underlying mechanism of control. But that's exactly where, for me, conceptual precision becomes so important. I fully acknowledge the practice clearly involves violations of women's bodily autonomy and freedom from coercion, violence, and degrading treatment. That's undeniable. But look closely at the methods themselves. FGM typically involves a definitive, immediate, often irreversible removal or alteration of tissue. That necessitates a very specific kind of medical and legal response.
Okay, but why is that difference in method so significant that it should somehow diminish the comparison in concern, the level of concern?
It's around the method of harm. We know these practices differ vastly in method. One involves cutting, excision, the other involves stretching over time. And that distinction really matters when we talk about effective remediation, effective help. Labial elongation, while yes, it's painful, it's harmful, it's a gradual process. The harms cited are things like pain, a high risk of infection, anxiety, shame, body dysmorphia. These specific harms, plus the documented interference with schooling, these are distinct violations of child rights and freedom from degrading treatment. If we just generalize them too quickly under this FGM-like umbrella, we risk, sending the wrong kind of intervention team or maybe diluting the specific focus needed for community education against that kind of sustained coercion.
I understand the risk of conceptual dilution. I do. But if we prioritize the specificity of the method over the similarity in concern, don't we risk missing shared opportunities for global advocacy? We have to keep coming back to the shared root cause here, the control of female bodies to fit expectations set by others. That's the common denominator, isn't it? And that's what justifies the similar in concern classification. If the ultimate goal is enforcing harmful gender norms through non-consensual bodily modification, regardless of whether that modification is done with a blade or through gradual painful stretching, the structural severity, the core violation, it feels identical. This classification ensures that the severity of the gender discrimination isn't somehow overlooked in global human rights frameworks just because the physical tool isn't, sharp steel.
I'm sorry, but I just don't quite buy that linkage as the most useful one because it seems to ignore the utility of specificity when you're actually designing policy or interventions. While the motivation might be structural control, yes, the means of applying that control are often what dictate the most effective remedy. The legal approach to FGM, for instance, often targets a single, definitive act of alteration. Laws are frequently drafted to criminalize that specific moment. But here, what we're addressing is ongoing, sustained social pressure. It's coercion enforced by community expectations, by these painful daily routines. If we don't highlight that difference, then our strategies for prevention, which absolutely must involve education and challenging social norms over potentially many years, they might just be inadequate. We need strategies tailored to gradual coercion, not necessarily singular surgical type events.
And let's maybe zero in on what might be the sharpest tool we have for prevention: the whole issue of age of consent and child rights. The source material really emphasizes the severe violation of girls being pressured into this elongation before they can understand or agree. Now, this clearly highlights the violation of child rights of informed consent. It's separate from, though obviously driven by, the gender norm reinforcement. So does focusing on the lack of capacity to consent, which is a clear, immediate violation under the UN Convention on the Rights of the Child, does that maybe provide a stronger, perhaps more actionable legal framework than generalizing the harm under structural gender violence? It feels like a cleaner leverage point, legally speaking.
That's a compelling point for legal strategy, definitely. But I would argue that the lack of consent here is inextricably linked to the gender discrimination. You really can't decouple them in this context. The very reason a child's consent is so easily bypassed, so easily ignored, is precisely because of the underlying gender norm, the expectation that one's body must be modified for male pleasure or societal control. That expectation inherently negates the child's autonomy, regardless of their specific age or cognitive capacity at that moment. The practice inherently reinforces these harmful gender norms, which is structural violence in action. If we only focus on the lack of capacity to consent, we risk treating it like some kind of technical legal oversight, rather than recognizing the systematic dehumanization of young women that's embedded within that structure.
I think we absolutely can and should address both simultaneously, but precision still matters most when it comes to advocacy and action. When the material highlights things like anxiety, shame, or body dysmorphia, well, these psychological harms are amplified precisely because the girl is being pressured to change her body against her will for someone else's approval. The remedy for that kind of psychological harm, for that lack of autonomy, it demands specific attention to the coercion and the degrading treatment involved. And those are distinct rights violations that really stand on their own merits, even if they are, symptoms of a larger structural issue.
Okay, let's look at maybe the most tangible daily harm cited in the material, which brings us right back to the definition of a harmful traditional practice. The source emphasizes the concrete impact on a child's actual life. The time and energy spent doing painful daily stretching routines can interfere with schooling and normal childhood. We have to recognize this as a kind of systematic theft of a girl's childhood, theft of her future education. This isn't just some vague psychological harm. This specific disruption is a tangible violation of her autonomy over her own time, her own life path. This interference ties directly back to the idea of a harmful traditional practice, precisely because the tradition itself directly undermines fundamental rights. the right to education, the right to healthy development. It feels like structural control enacted daily, literally consuming their future.
I agree completely that the educational interference is profoundly serious. I mean, it can affect the child's entire life trajectory. However, I still want to probe whether this specific disruption is best addressed by just lumping it into the very broad, gender-based violence category. That category often, though not always, implies direct physical trauma as the primary mechanism of harm. Here, these specific tangible disruptions, the loss of education, the loss of time, they actually seem to make the case stronger for classifying it as degrading treatment and clear interference with a normal childhood under the Child Rights Convention. Focusing there might help direct resources more effectively towards educational and social support interventions, rather than solely relying on broad legal condemnation, perhaps associated more with physical violence paradigms.
But if the degradation and the pain and the interference with schooling are all being enforced because the girl's body must be modified to fulfill a gendered expectation, one set by men or by society, then the root cause still seems to me to be gender-based violence. The outcomes you mentioned, loss of schooling, loss of time, the pain, they're the evidence of that violence. The harmful traditional practice label, framed as similar in concern to FGM, provides the necessary lens, I think, to address the entire coercive system, rather than just isolating the individual harms like, say, an infection or a missed day of school as separate incidents. We really need to zoom out to address that systemic coercion effectively.
And I absolutely concede we must address the system. But I still maintain that the precision of the remedy matters critically. Acknowledging that the methods of harm and the resulting physical and psychological outcomes are distinct from those typically associated with FGM, that ensures that our preventative strategies, our intervention strategies, especially things like funding for education initiatives and community dialogue, are tailored precisely to the nature of the coercion described here and to the specific impact on education and autonomy. If we claim it's too similar to FGM, while we risk funneling resources into, say, medical or surgical prevention initiatives that just aren't the primary need in this specific context.
So, in conclusion, my argument really rests on the systemic nature of this violation. Based on the evidence presented, the structural gender inequality, the clear violation of consent at a young age, and the profound physical and psychological harm, including, crucially, the effective blocking of a girl's educational future, I believe the classification of labial elongation as a serious, coercive gender-based violation, similar in concern to FGM, is necessary. It's necessary to correctly address and ultimately dismantle the root system of control over female bodies.
And I would conclude that while this practice is, without any doubt, harmful, coercive, and a profound rights violation, this discussion really highlights the importance of conceptual clarity. I believe that focusing on the distinct violations, bodily autonomy, freedom from coercion, interference with education, provides a more precise and ultimately, I think, a more actionable framework for intervention. It helps ensure that our response is perfectly tailored to the unique nature of the coercion it's cited in the material we're discussing.
Ultimately, I think what the material clearly establishes, regardless of maybe our preferred classification nuance, is that labial elongation is a severe issue. It stems from structural control, and recognizing both the broad legal categories that apply and the nuanced nature of the specific harms cited, well, it just reinforces the value of demanding accountability across all relevant human rights conventions.
Indeed, it underscores the need to use every tool we have, both the precise ones and the broad ones, to tackle these pervasive violations of girls' autonomy and fundamental dignity.